Well, it's Wednesday, and that means it's Wellness Wednesday to be exact. And here with Dr. Ellen Rain from the Southeastern Spine Institute. She's got some information about back pain that more than you would imagine, more people than you would imagine are dealing with. We're talking about tailbone pain.
Yes.
And I am not going to even attempt to pronounce this word, so do it for us.
Okay, it's called coccydynia.
Okay.
So it's pain involving the very tip of your tailbone, which is actually called your coccyx. So you have your lumbar vertebrae here, your sacrum here, and then this very tip here is called the coccyx.
And that even hurts when you're just sitting down sometimes.
Yes. I actually see a great deal of patients in my office who have this pain, and that is their #1 complaint. I mean, that they can't sit. And talk about things that you might take for granted. I mean, just the ability to be able to sit. You know, for people that work desk jobs, this can be terribly problematic. And so, you know, usually it affects women more than men. And it can be caused from, as you might imagine, a slip and a fall right on your tailbone. Also, even childbirth, people can experience this kind of pain after childbirth. And the other thing that really people need to be aware of is that sometimes pain, even though we feel it in one place, might actually be generated from another site.
So almost like a radiating pain?
Yeah, we call it a referred pain.
Okay.
So it could be, in very rare circumstances, it could be that a tumor or something going on in your abdomen could be actually causing you to feel pain as tailbone pain. So whenever somebody comes in with this symptom, we always want to make sure, you know, have we had proper imaging, maybe an MRI of the pelvis or the abdomen, and also special blood tests that can be performed by your primary doctor, just to rule out. You always just want to make sure that this isn't coming from something else.
Yeah, and Dr. Ellen, living a sedentary lifestyle, a lot of people might say, oh, well, the pain is so bad, I can't go to the gym, I can't work out, I can't walk, but that could possibly be making it even worse.
Oh, yes, absolutely. I mean, even one thing that a lot of people do when they have this pain is it hurts when you sit down straight, so they end up sitting off to the side.
So you're messing up something else.
Exactly. So you're kind of causing another problem. If you sit off to the side for a year or 2 or 3, then other joints and things and muscles are going to compensate for that, and then before you know it, you have 2 or 3 problems instead of just one. So it's important, as we always talk about, to come in and be evaluated and get this treated and worked up sooner than later.
And this is a non-surgical procedure, you were telling me earlier.
Oh yeah, absolutely. There's really not a surgery that can be done for this. I mean, in the past, people have actually had their tailbones removed, but unfortunately...
forgive me, I know somebody out there is going to ask the same question. If you get your tailbone removed, then what do you do? How do you sit down?
Well, you don't really need it per se for anything, but the problem is it doesn't make the pain go away. So that's really not something that's done. What some of the first things that you might try at home would just be use of anti-inflammatory medications. This could be inflammation of the ligaments around your tailbone, and so also use of a donut pillow so that you're not putting pressure on that. And then if you need to come in and get seen by us, we can try other things like injections and other types of medications, and maybe some physical therapy, aquatherapy as well.
Yeah, that'll kind of ease the pain, at the same time kind of repair the issues that you might already have.
Absolutely, absolutely.
Well, she's Dr. Ellen Rain, and you can find her at the Southeastern Spine Institute. If you got any questions, just go to southeasternspine.com. You're located on Chuck Dolly Boulevard, and you'll be in the new building soon. So we'll give you the information when it opens. We'll for sure let you know. Dr. Ellen, thank you so very much for being with us. We do appreciate it.
Okay, thanks.
And don't forget to submit your questions to Ask Dr. Ellen. It's on abcnews4.com, and all you got to do is click on the Low Country Live tab, and your question might be read on the air. Thanks, Dr. Ellen.
Thank you.
All right, well, when we come back for Low Country Live, Chef Brett McKee is back in the Low Country Live kitchen, cooking up something delicious and nutritious. Stay with us.